Many adults over 60 notice something subtle but persistent happening inside their bodies after ordinary meals. The food is not the problem, and their habits may not have changed very much over the years. Yet the stomach feels heavier than before. The abdomen swells slightly after dinner, and energy disappears faster than it used to. For many older adults, the discomfort does not appear as severe pain or illness, but as a constant dull pressure. That pressure may show up as bloating, slower digestion, irregular bowel movements, or a lingering feeling of fullness. Some people even begin avoiding certain meals because they already expect discomfort after eating them. This experience is extremely common after the age of 60, and it is rarely discussed in detail. Many assume that digestive decline is simply a normal part of aging that cannot be changed. But modern digestive research shows something different and far more encouraging for older adults. In many cases, the digestive system has not failed at all. Instead, it has simply slowed down because several biological rhythms have weakened over time. When those rhythms slow, food moves more slowly through the stomach and intestines. That slower movement creates fermentation excess gas and a sensation of heaviness after meals. Understanding this simple mechanism can change how we approach digestive discomfort in later life. The goal is not to force the digestive system with harsh treatments or expensive supplements. The goal is to gently restore the natural rhythm that once kept digestion smooth and comfortable. This video gathers information from nutrition science, gastroenterology research, and traditional dietary habits. It explains several drinks often discussed in digestive health circles and evaluates them carefully. Some drinks provide mild support and help the digestive system maintain its rhythm. Others have stronger evidence suggesting they may improve digestive comfort or movement. And a few combinations show promising results in clinical digestive research when used consistently. This information is educational and designed to help you understand digestive function more clearly. It does not replace medical care diagnosis or professional treatment from your healthcare provider. If you experience severe symptoms or sudden digestive changes, medical evaluation is always recommended. But for many adults, over 60 small daily habits can still make a meaningful difference in comfort. As people age, the digestive system undergoes several gradual biological changes that affect how food moves. The muscles of the digestive tract still function, but their rhythm and coordination may slow slightly. This slower rhythm can extend the time food remains inside the stomach or intestines. When food stays longer than necessary, fermentation can increase and gas may accumulate more easily. The sensation people feel is not always pain, but rather heaviness pressure or uncomfortable fullness. Gastroenterology research describes a natural digestive pattern called the migrating motor complex. This mechanism acts like a gentle cleaning wave moving through the digestive tract between meals. It pushes leftover food particles and digestive debris through the intestines in a coordinated motion. In younger adults, this wave occurs regularly and keeps digestion moving smoothly throughout the day. However, studies suggest this rhythmic activity can weaken gradually as the body ages. When the cleaning wave becomes less active, the digestive tract may not clear residues as efficiently. That slowdown can contribute to constipation, bloating, and a lingering sense of incomplete digestion. Many factors influence this change, including hydration, diet, quality medication use, and physical activity. Certain medications commonly used in older adults may also slow digestive motility unintentionally. For this reason, digestive changes after 60 often have multiple overlapping causes rather than one single problem. Understanding that complexity helps explain why quick fixes rarely provide lasting digestive comfort. Improving digestive rhythm usually requires small, consistent adjustments, rather than dramatic, short-term solutions. The drinks discussed in this script aim to support digestion gently through hydration enzymes, probiotics, or digestive stimulation. None of them should be viewed as miracle treatments that instantly solve every digestive difficulty. Instead, they may serve as supportive habits that encourage the digestive system to regain natural movement. Consistency often matters far more than intensity when it comes to digestive health in older adults. Digestion is not an isolated process that only determines whether food leaves the stomach efficiently. The gastrointestinal tract interacts continuously with the immune system, nervous system, and metabolism. Large amounts of immune tissue are located throughout the intestinal lining and surrounding structures. This network helps the body monitor microbes, nutrients, and potential irritants entering through food. When digestion becomes sluggish, the intestinal environment may change in subtle ways. Gas production can increase, and microbial balance may shift slightly in response to slower food movement. These changes sometimes influence how energized or comfortable people feel after meals. Many individuals over 60 notice that digestive discomfort also affects sleep quality and daytime energy levels. A heavy stomach in the evening can make it harder to fall asleep or remain comfortable overnight. Morning fatigue may follow when digestion remains incomplete from the previous night's meals. For that reason, improving digestive comfort can indirectly support overall well-being and daily vitality. However, it is important to remember that digestive symptoms have many possible causes. Hydration levels, fiber intake, medication, interactions, and stress can all influence gut function. Therefore, no single food or drink can replace balanced diet, medical care, and healthy lifestyle habits. The drinks discussed later should be seen as small supportive tools within a broader wellness strategy. When used thoughtfully, these habits may help restore a smoother digestive rhythm for some individuals. Many people over 60 receive very common advice when they complain about digestive discomfort. They are told to drink more water, increase fiber intake, and consider probiotic supplements. Those recommendations can be helpful and often improve digestive function for many individuals. However, they do not address every possible digestive pattern or underlying cause of discomfort. Some individuals increase fiber dramatically, but experience more gas and bloating rather than relief. Others take probiotic capsules, yet still feel heavy or sluggish after ordinary meals. These experiences can be confusing and frustrating for people who feel they are doing everything correctly. One explanation may involve the timing and rhythm of digestion, rather than only the ingredients consumed. If digestive movement is slow, adding more material into the system may temporarily increase pressure. This does not mean fiber or probiotics are harmful or ineffective in general. It simply illustrates that digestive health is more complex than a single universal recommendation. Sometimes gentle digestive stimulation or enzyme support may help food move more efficiently. In other cases, soothing irritated intestinal lining may reduce gas and pressure sensations. And for many individuals, a combination of hydration, fermented foods, and digestive spices works best. The ranking that follows describes several drinks frequently discussed in digestive wellness research and nutrition practice. Each drink has strengths, limitations, and situations where it may or may not be appropriate. Understanding those differences can help older adults choose habits that match their individual needs. Before exploring the list of drinks, it is important to explain how they are being evaluated. The ranking is not based on marketing claims or popular trends circulating online. Instead, it considers several practical factors relevant to digestive comfort in older adults. One factor is whether scientific studies suggest the drink influences digestive movement or enzyme activity. Another factor is whether the drink may help reduce bloating or post-meal discomfort. Safety is also extremely important, especially for people who take medications regularly. Some natural ingredients interact with medications or aggravate certain digestive conditions. Ease of preparation and cost also matter because habits only work if people can maintain them daily. With those criteria in mind, the drinks will be presented from mild supportive options towards stronger combinations. The early entries on the list provide modest assistance for digestion, but rarely transform symptoms alone. Later entries combine several mechanisms that may support digestion more noticeably for some individuals. Remember again that responses vary widely between people and consistency is always essential. 8. Black coffee. Many adults naturally reach for coffee when digestion feels slow or bowel movements seem delayed. This habit exists for a reason supported by several gastroenterology studies examining colon activity. Research has shown that coffee can stimulate colon contractions in some individuals shortly after consumption. These contractions may encourage bowel movement and explain why coffee sometimes triggers morning bathroom visits. However, the effect varies widely and does not necessarily address the underlying causes of digestive sluggishness. Coffee is also a mild diuretic, meaning it can increase fluid loss through urine production. If someone drinks coffee without enough water, stool may actually become firmer or more difficult to pass. In addition, caffeine can aggravate reflux symptoms or sleep disturbances in sensitive individuals. For these reasons, coffee should be viewed as a mild digestive stimulant rather than a comprehensive solution. People who tolerate coffee well may consider drinking a warm cup in the morning with adequate hydration afterward. But relying solely on coffee rarely restores long-term digestive rhythm when deeper factors are involved. 7. Aloe vera juice. Aloe vera juice is frequently promoted in wellness discussions for its soothing properties. The plant contains compounds that have been studied for potential anti-inflammatory and digestive effects. Some small studies involving individuals with irritable bowel symptoms suggest aloe preparations may reduce discomfort. However, research findings remain mixed, and aloe products vary widely in preparation and concentration. Certain components of the plant can act as laxatives when consumed in significant amounts. While that effect might temporarily relieve constipation, it may also cause cramping or loose stools in excess. Commercial aloe beverages sometimes remove these compounds, but not always completely. Therefore, individuals considering aloe juice should use moderate amounts and observe their body's response carefully. Aloe may provide soothing support for irritated digestive lining, but it is rarely a primary solution for slow motility. 6. Warm ginger and lemon water. Ginger has been used for centuries in traditional diets to support digestion and relieve nausea. Modern research has examined how ginger influences stomach emptying and digestive muscle contractions. Several studies suggest ginger can accelerate gastric emptying slightly in healthy volunteers. This effect may help food leave the stomach more efficiently and reduce sensations of heaviness. Lemon adds mild acidity and flavor that can stimulate digestive secretions and appetite. The combination of ginger and lemon therefore offers gentle digestive stimulation before meals. However, the effect tends to be temporary and usually lasts only a few hours. For individuals with sensitive stomach lining or reflux-strong ginger preparations may occasionally cause irritation. Using moderate amounts in warm water before meals often provides a comfortable balance. This drink is simple and inexpensive and may encourage the digestive system to begin working more actively. 5. Soothing herbal teas. Certain herbal teas are traditionally used to calm irritated digestive lining and reduce gas formation. Two examples often discussed are marshmallow root and slippery elm bark preparations. These herbs contain mucilage, a gel-like substance that coats and soothes the intestinal lining. Rather than stimulating digestion directly, they help reduce irritation that may contribute to bloating. People who experience gas when increasing fiber sometimes find relief with soothing herbal preparations. However, these herbs may slow the absorption of certain medications when taken at the same time. For safety, they should generally be consumed at least 2 hours apart from prescription medications. Their taste is mild and earthy, making them easy to include as evening or pre-meal beverages. Although they do not dramatically accelerate digestion, they may provide comfort when the digestive tract feels sensitive. 4. Kefir with ground flax seed. Fermented dairy beverages such as kefir contain diverse communities of beneficial bacteria. Nutrition research describes kefir as one of the most microbiologically complex fermented foods. These microbes may support microbial balance within the digestive tract and aid digestion for some individuals. Ground flaxseed adds both soluble and insoluble fiber that can improve stool texture and intestinal movement. Clinical trials in certain patient groups have shown flaxseed improving constipation-related symptoms. Together, kefir and flaxseed provide hydration fiber and beneficial microbes in one simple mixture. Many people find this combination helps normalize bowel movements, within a few weeks of consistent use. Flaxseed should be ground rather than whole so the body can absorb its nutrients properly. People taking blood-thinning medication should discuss flaxseed intake with their healthcare professional first. 3. Apple cider vinegar tonic. Apple cider vinegar gained enormous popularity online as a supposed universal health remedy. Many of those claims were exaggerated or unsupported by scientific evidence. However, vinegar does influence digestion through its acetic acid content and metabolic effects. Some research suggests vinegar may improve post-meal blood sugar responses in certain situations. Other studies indicate vinegar may delay stomach emptying in individuals with diabetic gastroparesis. This means vinegar may not be appropriate for everyone experiencing digestive discomfort. For people with normal stomach motility, small, diluted amounts before meals may stimulate digestive secretions. Using too much vinegar or drinking it undiluted can irritate the throat and damage tooth enamel. Moderate dilution in water is essential for safety and comfort. Because digestive responses vary, vinegar tonics should be introduced gradually and discontinued if discomfort appears. 2. Tropical fruit enzyme. Drink. Pineapple and papaya are well known for containing digestive enzymes such as bromelain and papain. These enzymes help break down proteins and may support digestive processes when consumed with food. Bromelain has been studied extensively for anti-inflammatory and digestive-related biological activity. Fresh fruit contains these enzymes naturally, along with vitamins and hydration. Blending pineapple and papaya into a smoothie provides both enzymes and dietary fiber. Some individuals report feeling lighter after meals when they include enzyme-rich fruits regularly. However, enzyme content decreases quickly after blending or cooking. For that reason, fresh preparation often provides the strongest effect. Although fruit enzymes support digestion, they should not be viewed as powerful treatments for severe constipation. They are best understood as supportive additions to a balanced diet rich in natural foods. 1. Ginger and artichoke digestive tonic. One combination that has received scientific attention involves ginger extract, together with artichoke extract. Clinical trials investigating functional dyspepsia have evaluated this mixture for digestive comfort. In one randomized controlled study, participants taking ginger and artichoke extracts experienced greater symptom improvement than placebo. Participants reported reduced feelings of fullness and improved comfort after meals during the study period. Ginger contributes digestive stimulation, while artichoke compounds may encourage bile flow and fat digestion. Together, they support several digestive mechanisms simultaneously, rather than targeting only one pathway. For individuals experiencing heavy sensations after meals, this combination may offer noticeable relief. Fresh ginger and artichoke preparations can be incorporated into simple evening tonics before dinner. As with any natural ingredient, people using blood-thinning medication should discuss ginger intake with their physician. When used appropriately, this drink represents one of the more promising dietary approaches for digestive comfort. The most effective digestive strategies are usually the simplest and most consistent. Choose one primary digestive beverage that feels comfortable and sustainable for daily use. Many people prefer ginger-based tonics in the evening because digestion often slows during nighttime hours. Morning routines might include fermented foods such as kefir combined with ground flaxseed. Hydration throughout the day remains essential because water supports intestinal movement naturally. Introducing several new habits simultaneously often leads to confusion or abandonment of the routine. Start with one change and observe digestive comfort over several weeks before adding additional elements. One frequent mistake is expecting immediate dramatic results after only a few days. Digestive patterns that developed over years rarely reverse overnight. Another mistake involves drinking digestive beverages directly with large meals, rather than beforehand. Allowing a short interval before eating often provides the digestive system time to respond. Ignoring hydration is another common oversight that contributes to persistent constipation. Even beneficial ingredients may cause discomfort when used in excessive quantities. moderation and patience remain the most reliable approach to digestive improvement. Digestive discomfort is common, but certain symptoms require prompt medical attention. Unexplained weight loss, persistent vomiting, blood in stool, or severe abdominal pain should never be ignored. Sudden changes in bowel habits after age 60 also deserve evaluation by a healthcare professional. These signs may indicate conditions that require diagnostic testing or treatment beyond dietary adjustments. Natural beverages and dietary habits can support digestion, but they cannot replace medical diagnosis. Maintaining open communication with healthcare providers ensures digestive strategies remain safe and appropriate. Digestive changes with age are common, but they do not always represent irreversible decline. Often the digestive system simply requires supportive habits to regain its natural rhythm. Fermented foods, hydration digestive spices, and balanced meals can encourage smoother digestion. Small daily choices accumulate into meaningful improvements over time. Rather than searching for miracle cures, focus on consistent routines that respect the body's natural processes. Your digestive system has served you faithfully for decades and still retains remarkable resilience. With patience, thoughtful nutrition, and appropriate medical guidance, many older adults regain digestive comfort. Improving digestion is not about reversing age, but about supporting the body's natural intelligence gently. When rhythm returns, meals become enjoyable again, and daily energy often improves naturally.